Good afternoon. Good afternoon, everybody, and welcome to the mHealth afternoon session, Mobile Applications and Social Media. Today, we're excited to answer the question, does social media and applications impact consumer health? My name is Mike Reincheck, and I'm the president of SpireTrap. We are a mobile and online marketing firm, which we do a great amount of work within the healthcare space. This evening I have with me Pat Karen, Senior Director of Innovation and R&D at United Health Group. We have Kamal Jeffwani, Corporate Manager of R&D for Partners of Connected Health. And then I also have with me Marty Webb, Vice President of Benefits for AT&T. The way the session is going to go is I'm going to have each speaker come up and they will do a 10-minute presentation on their specific topic. And then from there, what we'll have is enough time, hopefully towards the end, for you, the audience, to ask these guys any questions that you might have. But I must say, before we get started, we're very excited about this session. Personally, where I sit on the consulting side, we do a lot of work within the healthcare and technology space. So what's so exciting about this session is we have many different perspectives. We have the payer, we have the provider, and then of course we have the technology provider as well. So hopefully this is a very engaging session, and hopefully towards the end you will all have many, many questions and great conversation points to bring up towards the end. So with that, I would like to welcome Pat Karen to give his presentation first.
Thank you, Mike. And yes, this is the last session before bar time, so we'll try to make sure we are on time when we finish up here today. So it's kind of a daunting task that I have to go first in front of a Harvard doctor and AT&T being the largest one of the largest companies in the world here. So I'll try to keep to my point here, as these are the experts. In any case, my name is Pat Karen. I am with United Health Group, and we are here to talk today about social networking, social media, and mobile, and will they have an impact on healthcare? And the answer is yes, they will have an impact on healthcare. And there's a number of ways that we're going to have that impact industry-wide, beyond industry-wide, through a number of different ways. And so actually, if you go to the next slide, please. There we go. We have to do this the old-fashioned way, so much for technology here. In any case, what we have is we have a number of influencers that traditionally have been very helpful in making you, or in this case, Scott, the consumer, very informed around healthcare. You have things such as his parents, siblings, friends and family, doctors and nurses. If you could advance one more, please. Now, in this digital age, you have social networking. And social networking has been around for thousands of years. In the digital age now, it's just a lot easier and convenient to get that information. Next slide. And so here what we have is, if you can go one more slide, please. Here you may have your traditional, your mom saying, yeah, Dr. Smith, he's a quack, don't go to him. But now you have these social networking sites that you can go out, and you have someone like Mom 8 saying, hey, doctor is great, I'm going to bring all my kids back to him. Or the next one is Tuck, which is the doc's the bomb. And the next one you have is PDog73 saying, hey, next time I'm bored and I break my arm, I'm going to go back to you, doc. So you have this social network. You have no clue who these people are. But if they are talking about Dr. Smith as being a really good doctor, that might outweigh what your mom is saying about that doctor. And you have no clue who these people are. So social influence through these networking sites are really going to be vital when it comes to helping you make decisions. If you can go to the next slide, please. So what we have is, what are people doing out on these social networking sites? They're doing a number of things, such as joining health-related groups, looking for health information, reading information on others that may have similar circumstances when it comes to healthcare, posting comments or questions, looking at clinical reviews and rankings, And all of these, in fact, you know, I'd love to take a poll in the room here right now. How many of you have done at least one of these before? Yeah, so at least half the room here has done something like this before, and it's going to continue along this path. So from a United Health Group standpoint, we're actually meeting the customer or the consumer where they want to be met. We are doing these things as well, and not only us, others in the industry as well. Go to the next slide, please. So here's some some fun statistics here. Through your mobile devices here, people are doing about almost 3 hours a day on social networking sites through their mobile applications, through their mobile devices. Mobile searching through for internet searches are going to become more prevalent on mobile devices by 2014 than even on desktops. So the prevalence of mobile applications is ever growing. In fact, I heard a stat not too long ago here that in the palm of your hand, if you have an iPhone, an Android, whatever it is, you have more computing power in that device than NASA ever did in the 1960s to launch the first rocket. It's just amazing that we have that power in our hands now, and we need to utilize that through social networking, through a number of health care needs. Next slide, please. And so what are we doing to help meet our customers where they want to be met? We're doing things such as educational sites, such as UHC.com. It's a free internet site here where any consumer can go out via mobile device, via portal, and get all kinds of healthcare information, not just healthcare insurance information, but rather nutritional information, healthy recipes, how do I manage my diabetes, etc. There's a number of things out there, and we're one of the many that are out in this space today that you can get health education. Next slide. We're also doing things such as doing social networks within group or health achievement applications. And again, us being one that are out in the marketplace, one of many out in the marketplace today, we're allowing social networking to be a part of our healthy applications and our healthcare applications. And that reason is that social networking has an influence on making healthcare decisions. So here as an example, we have a healthcare application called OptimizeMe, which allows you to really put in place a number of things around tracking information, maybe such as weight or maybe a number of steps that you're doing, etc. So you set these up through challenges, and the challenges can be done either publicly or privately. But publicly, what you're doing is you're able to reach out to your social network, Facebook, Twitter, whoever it is, and invite them in to do these challenges with you. A great example of this is that we like to test on our own employees. And so we have done a healthcare challenge using this OptimizeMe tool here through social networking, where we reached out to all of our employees to challenge them for an upcoming heart walk. And that challenge was, if as a company we can log 5,000 steps, United Health Group will donate $25,000 to the Heart Foundation. And so with that, there was a carrot. There was some incentive there to go out and make sure that we can have that donation go out to that Heart Institute. In any case, we had a number of employees go out there, socially talk about this, talk about challenging one another. And by the way, with this application as well, is that it uses some of the gaming principles. And so you can award people badges or awards for doing the right thing. And so in any case, you can start promoting this, incentivizing this through this $25,000 donation. But also, I can tell Mike over here, if he was an employee, to say, hey man, you're not doing your steps. You better get going. I'm challenging him. In any case, what it is that not only did we meet the goal of 5,000, we crushed the goal of 5,000. 10,000 steps, and we did the donation. So there's incentives like this that really help us, but then also engage us into our healthcare. Next slide. And in this application here, this is more future thinking. The application itself is out there. It's around health navigation. But what we're going to be doing is that we're going to be putting in place here basically your Yelp or your Amazon review on providers, on physicians, on locations. But we have to be very careful with this, and that our provider network may not want just anyone, PDog73 as an example, saying something bad about him or her. Rather, what we're doing is we're taking a balanced approach here. And that approach is that we're taking quality measures from the medical community along with putting these reviews together so you have a balanced a thought or an opinion in regards to what these providers are doing. Next slide, please. We're also taking, actually one more. We're also taking the same approach here in a transparency tool that we have as well, that when you start pricing out the cost of a procedure and identifying the doctor or doctors that you want to go to, it's the same thing. We're going to have that quality review along with the review from individual members of the community. Next slide. We're also looking at different social patterns when it comes to putting incentives or catalysts in place around healthcare as well. Now, this is kind of not necessarily a concept. We're actually doing this weight loss kit today, where we identify people that meet certain criteria through a number of pieces of information that we can go out and give them a weight loss kit to help them manage maybe some of their obesity or whatever it is. Could we also use social networking, social media, and that data that's aggregated from these sites to understand social patterns? Could we identify those influencers in specific markets and maybe those influencers that meet profiles of unhealthy living? And could we give them some kind of catalyst, such as a weight loss kit, to help influence them take the right action against their health care? But not only that, for that individual, will they also influence those in that social network to do the same thing as well? So there's a number of ways that we're starting to look at utilizing social networking data to help us identify those influencers out in the marketplaces today. And the last slide. We're also using the big data concept here to start taking, again, that social media data and pulling it together. So when you are going out to a specific marketplace, as an example, I have to go out to LA later this week to meet with some customers. If I understand what some of the hot topics are out in LA based on what is being tweeted or what is on Facebook or whatnot, I'm going to become better educated to start talking about that with my customers before I get there and before they bring up to me all of this banter that might be going on out in the social networking realm. So it's another way for us to become prepared when talking to our customers and addressing those hot topics as well. So there's a number of ways that we're using social media, social networking, and mobile devices to drive care decisions for our providers, for our members, and for us internally as well. And I think this is only the tip of the iceberg when it comes to utilizing social and mobile for healthcare decision making. So that's all I have at this point here. I'd like to turn it over to Dr. Jeffwani to talk about his presentation.
Thank you, Pat. That was awesome. I'm going to try to pull up my slides. All right, we'll start anyway. So bear with us. Some of my slides build up, and we're doing this remotely, so it might take a while. So I'm going to start off with the word or the acronym or whatever you want to call it, Olomo. How many have heard it? Awesome, great. I just heard it last month, so I'm not the first one. I'm going to credit one of our research fellows, Timothy Hale, for introducing me to this. But Olomo basically means social, local, mobile. I love it because it sort of combines the key elements of mobile and social together, and it really tells you where the pot of gold is. You know, it's like the Solomon Islands, and it really tells you this is probably the gold rush in healthcare, and social, local, mobile together probably will get you to a new height in healthcare that we might not have reached otherwise. So I'm going to start off with explaining some aspects of this, and I'm going to take a healthcare view of it. So you know, I've certainly been involved in a lot of other aspects, but I'm going to try to give you a provider view of what we're doing. Next one. So a little bit about where I come from. We're called the Center for Connected Health, based within Partners Healthcare in Boston. We're a large umbrella organization that serves about two large teaching hospitals and 14 other smaller healthcare centers. The mission of the center itself is to use technology in meaningful, creative ways to change how healthcare is delivered. We use technology as an enabler of care. We always think about it as a way to get things done, not necessarily as the thing that we need to do. And over time, we've realized that the benefits of using technology in healthcare include improved engagement, improved outcomes, and improved efficiencies. And now with the triple aim, this becomes more important than ever before. A lot of you probably have seen this slide before, but we've broken down cell phone ownership by race, ethnicity. And this is sort of the mobile part of it, right? More than 80% people, broken down by race, across all races, own a cell phone. If you move to the third bar now, SMS, that is texting, is really high as well. And you can see, it's pretty consistent across all ethnicities. Smartphone ownership is rising. It's definitely 50% overall, but it's rising. It's really equal in across races. You're also going to see the last two bars, which get me excited. One of them being mobile internet use, and the other one being photo and video sharing. Because photo and video sharing sort of represents the high-end use case in smartphones, right? And what's interesting about mobile internet use is that there's an entire generation of people, if you read the Pew Internet Research reports, there's an entire generation of Hispanic, Latinos, low socioeconomic parts of our population that have skipped broadband completely, and they've just moved into mobile to use internet. And so these people have their only experience with the internet is using a mobile phone. And this number is going to grow as we go by. So, as we see smartphone ownership and penetration becoming better and better, you're going to see mobile internet use rising as well. Next slide. This slide sort of breaks social networking. And I like to break it by age because I've always heard the bias of, social media and social networking is all about young people. So let's look at it. 18 to 29, 86% people today use social networking sites. And now, I want to make a small difference between social networking and electronic social media. Electronic social media is just harnessing the power of social networking electronically. So having said that, 86% 18 to 29-year-olds use social media today at some point. And then about 34% 65 and over use social media today. That's a huge number compared to what we were maybe even just 5 years back, right? And this number is only rising. On a typical day, 43% of online adults will use social networking. Now, this is only third to email and search engines, and not that far away. You can easily imagine how social networking online is becoming more and more and more popular. And most of the social networking actually happens from your phone. So now you've seen mobile, and you've seen mobile penetration. On the other hand, you've seen social networks, electronic social media, and the adoption and the penetration there. And most of that happening on the cell phone. Think about this together and think about how you can create an experience that combines all of this, at least to be able to reach a really large population. How do you use this in healthcare, you're going to ask, right? So let's talk about using these or the consumer patient rise in healthcare. 78% US adults today use the internet, right? And a lot of them have used the internet to look for information online, 80% of them. 20% of them have tracked their weight, diet, other things on some sort of a mobile app or some sort of a web app. 73% want online access to their physicians, which is, high compared to 0% and maybe 10 years back. And 47% would consider switching doctors if they offered online access. And that's huge. That's a game changer. If I'm a physician who's not open to this, I might lose my patient panel tomorrow. Next, please. So let me talk to you a little bit about our online platform that has been very successful. We pride ourselves to be one of the first in the country to really think about data, really think about online access, and really think about connected health in a very unique way. And we've been testing and piloting and trying these systems out over the last 6 to 8 years, and we have a lot of amazing results. So the typical model is, we believe in objective data collection. So we have patients upload data at home. This is typical remote monitoring. Right, so you have weight scales, blood glucometers, et cetera. Patients take these devices home and upload their data. That data is directly transmitted to our database. And that database sort of analyzes it on the back end and presents it again to the physician and the patient themselves. The physician sees it as a population view and sees how their patients are doing, how their patient panel is doing. And patients get a individualized view to their own data. They can see tracks, they can see trends, they can annotate their data, they can do a lot of interesting things with it. And what all of this basically will do is it'll help physicians make decisions faster and more efficiently. It'll give physicians more data than they're used to getting, and that'll make their decision making better. At least that's the hope, right? And it'll empower patients by promoting self-management, because with self-management comes, all of the self-management techniques that we've seen so far have only shown that your healthcare improves and your number of utilization or your instances of utilization go down. And all of this is good news for healthcare. So how do patients engage in this, and what's the model we've seen? So keep building the slide, please. So if patients view and upload their data, we've seen that that's good for clinical outcomes. If your patient uploads and views and you provide some sort of coaching, that's even better. And the third thing is if the patient views, uploads, and gets coaching and has a provider engaged, it's the best. And we actually have data to prove this. So, if patients are in programs where the provider is not engaged, but they're still getting some sort of an automated coaching, we still see really, really good clinical outcomes, but we won't reach the maximum potential of what we can without the provider being engaged. And how are providers typically engaged? Providers, all they need to do is maybe see the readings once a week, react to them, maybe make decisions based on that, or even as simple as when the patient's coming for a visit, just make sure you have that website open and just have those readings available for you to talk about. Even as something as minimal as that has given us excellent outcomes in terms of clinical changes. So all of this now, all of this stuff we've developed over the past 7 or 8 years cannot go ahead or cannot scale without the use of mobile. And we really feel like mobile is not only a feedback tool where we can actually reach out to patients, but also a really great tool to collect data. You now have access to patients' cell phone utilization. You have access to a lot of things that patients do with their smartphones, and you can collect interesting data about patients to feed it back to them. Can you build this? Yeah. So we've used mobile in very interesting ways, and the key component of mobile, or of a mobile phone that is very interesting, is the power of simple messaging. A simple text message worth 160 characters, when delivered in the right way, in the right context, in the right manner to a patient, will do magical things, right? We've seen it work with medication reminders, prenatal care. We've seen it in a lot of other applications like diabetes management, hypertension management. The power of it is that your phone is always with you. It's mobile with you. It's local with you. And when I have the power of reaching you where you're at, it has the most amazing outcomes, because I can remind you in your path. You don't have to go anywhere. You don't have to come to me. You don't have to log in anywhere else. It's in your path. It's with you, and it reminds you when you need to be reminded. And because we try to use simple mobile interventions like text messaging, IVR, there's low barrier to adoption, and there's very high engagement. So here's a graph, and this is a study we did in 2005, where we gave patients text message and a sunscreen adherence device. All they were asked to do is wear their sunscreen every day. We divided them into 2 groups. One group received text messages, and if you see over 6 weeks, sunscreen adherence is something that people often forget, and you see that the intervention group actually kept up to their 60% intervention through the 6 weeks, whereas the control group dropped down dramatically, out to almost 20%. And all the message said was, please apply our sunscreen. Now, we know people won't open that message if we say only that. So how do we make it more interesting? Those were the days when we didn't have smartphones, and so it wasn't easy to check the weather, so we gave them weather updates every day. and they would open the message for the weather update and then see the message about the sunscreen and remember to wear it. And something as simple as that. I mean, it didn't take a rocket scientist, but we got amazing outcomes, and that sort of started us on the path of mobile. We said, this is powerful, this is inexpensive, we need to work more on this. We've reached very, very high levels of precision in being able to give people what's interesting to them. Today we don't do weather updates because that's so easy to find. We do more interesting stuff. We personalize messages based on people's EMR data. We personalize messages based on people's device data. Your blood sugar is X, your activity is X. You've not walked today, whatever it is, and we're able to do that and make it contextual, personalized to patients, and that's really powerful. Social networks. So, Pat talked a lot about social networks, and I know we're going to talk a little bit more about this now. But if you just go out there and think about social networking, it's not just Facebook anymore. It's Cure Together. Okay, so let me actually go through these and see how many people have heard of these sites. Cure Together. Show of hands. Okay. Patients like me. Okay, great. I'll tell you what it is, so don't worry. Nike Plus? Awesome. Okay. So Cure Together is a crowdsourcing site. And what they do is they basically will walk you through an algorithm where you can enter your symptoms. And based on your symptoms, they're going to ask you follow-on questions. Like if you have a cold, do you have a fever along with it? Do you have a cough along with it? And walk you through an algorithm to eventually give you a diagnosis. Obviously, the first diagnosis is viral infection, and they'll say 91% likelihood that you have a viral infection, 1% likelihood that you have cancer, right? And it gives you the whole range. And it's great because for an informed patient like me, that's amazing. I can sort of sift through the rubbish and take what I want to take from it. The interesting part is the step after that gives you treatment options. And those treatment options are, again, crowdsourced. So for 91% patients, all it takes is ginger tea. For 80% patients, all it takes is a good night's sleep. And that'll take care of your cold, so don't worry about it. And then they'll ask you, did you try any of these? And how did it work for you? So you're now entering your own data, and that's going to build into their database, and that's going to make their algorithm much stronger. So this is this amazing, crowdsourced, people-driven engine, and the utilization has gone high, completely high. They now have, sorry, just go back. Thank you. They boast of having more than 500,000 patients on it. It was recently acquired by another website, and they're doing really well. And that'll basically tell you what people need today, and you want to give them what they need. Patients like me, a lot of you seem to know about it, but it's really a place where you find patients like you. I have diabetes, for example, and I want to go and find patients who have diabetes and who are young and who haven't managed it well, and I can go there and find them. Now, given the site is more geared towards sort of slightly more chronic and more terminal illnesses, so you have way more patients with cancer and other things, but it's a great concept. Conceptually, it's really tying you in with patients who are like you, and it's very interesting how patients will immediately in this completely open forum open up about everything that's going on with them and share their own data. And it probably gives HIPAA people a nightmare, but that's fine, because as a patient I want to share what's happening with me, and I want to hear what other people are talking about. And it's they'll talk about clinical trials, they'll talk about experimental drugs, they'll talk about the effects, and as a researcher it's a data gold mine, but just even as a patient it's so amazing how patients connect with each other. I had a recent experience in my own family where my father was going through a terminal illness, and my mother, who was his primary caretaker, she had formed, because I wasn't local with them, she had formed her own network, a phone tag of like 20 people she used to meet in the waiting room every day, and they kept telling each other and sharing data about each other. Oh, yeah, today he went for his radiotherapy again, and no, my dad didn't go through it again today, but maybe he's going to go through it tomorrow. And it was amazing how all of them tracked each other over 6 months and shared so much about them. So many times I think she felt more comfortable talking to them than talking to me, because I was the physician who was telling her that, well, whatever, it doesn't matter if he's throwing up today. That's part of the drug treatment. And that sort of was very telling, because it really showed me how even in my own life I have these instances where I don't think physicians do enough for patients, especially in these diseases, and these resources are amazing. Great. Keeping me on time. No, you can go ahead. All right, so social media and healthcare. There's a lot of opportunity here, and there's not enough time to cover it. But patient acquisition, people have used that creatively for patient acquisition. Patient health education. Crowdsourcing data, I've showed you an example for that. Marketing, maybe Mike should talk about that. And then finally, patient and provider engagement. And I'm going to show you one example of a project I'm currently working on which focuses on patient and provider engagement. But really think about social in combination with mobile and local technologies, and think about how all of these combined will be really powerful. So my last slide. Yeah. So this is a project, we call it Connect to My Act, but it's basically a project for tracking teenagers who have asthma, right? These, we see about 18 to 20% follow-up rates in teenagers who have asthma in our system. 20% of them follow up, 80% of them never follow up. And so no matter how good you are as a physician, these people are going to keep landing up in the ER all the time. And an ER visit is really expensive. So what do? We wanted to catch these people where they're at. That's the theme I'm going to keep repeating. So we said, where are these teenagers? Normally, they're all on Facebook all the time, right? And so we said, okay, let's create something on Facebook. Let's engage them on Facebook, and let's have them take a survey on Facebook, which is going to reliably tell us whether these people are doing well or not. So we started with the ACT survey, which is a validated tool that will tell you with very good accuracy whether a patient is going to come back to the ER within the next 3 weeks or not. It's a symptom survey, 5 questions only. And so we said we'll post this on Facebook, and we'll have these people engage with it. We ran into a million issues with HIPAA, obviously, right? With sharing personal data and all that. But we got over that. We created on Facebook a secure, private environment for people to engage without ever revealing to their own friends that they have asthma, but still finding people like them on this small group and engaging with them. The outcome measure was ER visits. Can we do anything about ER visits? And so, if you think about each ER visit being $1,800 and each admission being $6,000 at minimum, even a 30% drop in readmissions would be phenomenal money saving. So this program is ongoing right now as a clinical trial, and we are very excited. Kids are engaging, I think. But more important than that is that in pre-testing and in focus groups, we found that kids loved it. They wanted to tell each other things like, what does it feel like to feel that, when do I really need a puff? What does chest tightening feel like? A physician can never tell you what it really feels like. They can just describe it to you. But these kids, the way they describe it to each other is magical. I didn't know so much about asthma as much as these kids obviously do because they live with it. When do I take my rescue inhaler? How do I carry my rescue inhaler? How do I tackle the fact that I don't want to take my rescue inhaler in front of my friends? I don't want to take it in the gym, but I'm going to need it in the gym. And so they'll be like, you know what, you should take it before gym class. That really helps because it kicks in by the time you need it. I didn't know that. They know it. They know that. They face that. So we see these kids engaging in all of that and being interested in all of that. And then, if they're engaged and love it and it's on Facebook, they'll take this survey every month and hopefully we'll be able to cut down some cost. The provider engagement part of this is interesting because as soon as we see their scores going down, the system automatically generates an email to the provider saying, kid not doing well, reach out and do whatever you want to do. And these physicians will reach out, will change meds, will try to get them to come in and see them, and that is how we'll change outcomes. Next slide. I think I'm done. Yeah. Thank you.
So I am the person between you and a drink, so I'll keep that in mind. And we're up there. So I was amazed sitting here, looking out in the crowd and seeing all the technology out there, all the devices, taking pictures of the charts, people saying hi to mom, all those things, and whatever the case may be. But I mean, that's what it's all about. It's utilizing technology to solve some of the problems that we have today. And as an employee of AT&T, I strongly recommend you go out and buy a lot of those types of devices. And pay no reckoning to the ribbing holding up your lanyard. AT&T is the company you want to buy them from. So that's my shameless marketing for the day. I'll move on. For the most part, I'm going to talk a little bit about something called Diabetes Manager, which is a product that AT&T is involved with and a product that we're piloting over our employee population. I have responsibility for benefits at AT&T. So my group actually manages all the benefits for our employees and our retirees, including health care. First, let me give you a little bit of background on healthcare and AT&T and why we're a little bit unique within the industry. For our employees are our biggest asset, like most companies, and so we have a number of programs under a banner called You Matter for our employees. You'll see Your Health Matters, which is the topic we'll be talking about today. Your Money Matters, which is about financial wellness for our employees. Things like savings plans, pension plans, compensation, and even broad financial planning. We feel that's important for our employees. Your Career Matters, which is about career opportunities, training, performance management and recognition, and Your Team Matters, which is about supervisor tools and diversity initiatives within AT&T. So moving on for the Your Health Matters portion of this, let me start by giving you a little bit of background on AT&T. We currently sponsor one of the largest private sector health systems in the country. We cover about 1 million employees, retirees, and their dependents. And so that's about 1 in every 300 people in the United States. If you look around this room, there's probably about 300 people here. So we would cover about 1 of you, and if you spread that across the company. We spend more on healthcare and healthcare types of benefits, health and welfare benefits, about $5 billion a year. Then a lot of business produced in revenue, or quite frankly, some states spend on Medicare. So we're sizable, we're significant. What happens at AT&T in many cases mirrors what happens across the United States. So we believe our employees are important assets, and we feel that we need to give them the right types of tools to manage their health care. And to do this, the whole workforce must be engaged to make healthier choices for themselves and their family. And so we've designed plans mindful of that. And in 2006, we introduced one of the first corporate-wide consumer-directed health plans for our managers and for certain retirees. We also prioritize preventive care by covering it at 100%, and that was long before it was required by federal legislation. And today, the AT&T Medical Plan, which is our high deductible plan, our CDHP plan, has about 300,000 participants. We also provide a vast array of health and wellness tools, resources under the Your Health Matters banner. I'd love to talk about all these tools today, but I'm just going to focus on Diabetes Manager for the most part. But I wanted to mention something about a social media effort we have, which is underneath our Your Health Matters banner. Since social media is one of the major themes of this conference, I just wanted to mention that we have an internal social media site specific to health. We have about 27,000 employees who are actively involved in blogs, reading of material, sharing of information. Actually was recently voted internally as the most valuable social media community with AT&T. And so it's really become a big deal at AT&T, just as it has more broadly. We're also running something called the Chairman's Challenge, which is actually an event we have underway right now. Our chairman is a part of this, where we've challenged employees to submit goals and follow their goals. It's creating quite a buzz around AT&T, and we're providing some awards both to the employees and charities as a result of that. So with this as a little bit of background, let me move on to an exciting technology that we're using called Diabetes Manager. There's been a lot of discussion about whether or not consumers are ready to begin sharing their healthcare data through the internet or mobile devices. And there's no doubt the adoption of internet and mobility is very strong. 82% of the U.S. regularly access the internet, and about 88% have a mobile device. But more telling is the fact that 80% of Americans have already utilized the internet to look up something about health information. And 53% of adults are either using mobile healthcare apps or have said they wanted to use applications. This is a critical data point, especially when you take into account that more people want to, quote, age at home. And one of the fastest growing segments for smartphone application and adoption is the over 50 population. So finally, every month, more and more Americans are accessing their healthcare information via mobile phones. That's about 16.9 million and growing. And what this clearly tells us is the population is ready for mobile health. So the mHealth space is increasingly being recognized for enhancing patient engagement and improving outcomes. And at AT&T, we're one of the nation's largest healthcare payers, and we are always looking for new ways to promote health and wellness. So that brings us to diabetes. Diabetes is one of the most common disease conditions, and as I mentioned earlier, AT&T sort of mimics the population. We're really no exception. So about a year ago, we began a pilot with our own employees to test whether they wanted an mHealth diabetes solution that could have an impact. And so we don't have the long-term data study, so we focused on key questions. Would the employees embrace it? Would they continue to use it? Does it have a sticking power? And would it impact behavior? So Diabetes Manager is a solution that provides adult patients with a new way to manage their type 2 diabetes by offering real-time feedback. Patients enter their blood glucose readings and medication data on their mobile device or on the web, and they receive real-time feedback. Later on, I'll show a video of exactly how it works. And so we had about 181 high acuity participants in this pilot. By high acuity, I'm talking about diabetes participants who are really the sickest of the sick. So people with really dire conditions. And this slide shows a breakdown of the Diabetes Manager pilot participants. The average age was about 54, and the average duration of how long they had diabetes was 10 years. What was clear in our findings is that behavioral change can take place no matter who you are or how long you've had the disease. Next slide, please. One of the key elements of success is whether or not people would adopt the program and sign up for a mobile tool. The response rates were much higher than we had projected. It's great to get users on the system, however, but would they use it once they're registered? So we looked at three key data elements: blood glucose levels, medication adherence, and carbohydrates, and we were pleased with the magnitude of the entries collected by the system. Within 6 months, we saw tens of thousands of entries from the group of 181 participants. And finally, a program's success is highly dependent on whether or not the participants would recommend it to others. And 9 out of 10 participants indicated that they would recommend the solution. So if you step back for a moment, you really have to say, is mHealth a fad? Are participants going to stick with it? We knew people would engage less as they learned from the system, but we were pleased at how people stayed engaged with the program. You can see from the top chart, there was a very low drop in using, even towards the end of the 6 months. I'm sorry. Yes, thank you. Even towards the end of the 6 months. But what's even more telling is that people really wanted to continue. We knew that as our participants were entering data and educating themselves on how to correct blood sugars and how to count carbs, or even how medications interact with their carbs, they could become less reliant on the tool. However, we were pleasantly pleased at how people stayed engaged with the program. And this becomes even more evident when you start comparing these numbers to other mobile applications on the market, in which 74% are discarded within the first 10 uses. Next slide, please. So now that we had a good idea that people not only would adopt the technology, but that they would stick with it, We wanted to measure whether or not it actually made a difference in how they manage their diabetes. So I know this is a little tough to read, but if you look at the bar on the left, the first pillar highlights that about half of the population said they were taking blood glucose readings on a daily basis before the pilot. However, during the pilot, this number increased to 74%, or 3 out of 4 participants measuring on a daily basis. In fact, post-pilot, 72% indicated the tool was highly useful in managing their condition. So I've had a chance to speak with the participants, and these are some tough situations, I have to tell you. One person said he'd been looking for a tool like this since he was diagnosed more than 10 years ago. Next slide, please. The participants feel they're much closer now to being fully in control. They're checking their blood glucose more often, adjusting food choices as needed, and benefiting from coaching, the coaching feedback of Diabetes Manager. So a while back, I got a chance to talk to a lady named Ann McQuaid, who has struggled for years with acute diabetes. And I'd like to share with you a brief day-in-the-life video of Ann McQuaid. I'd like to. Can you click on that again? I guess we're running out of time here, so they decided.
I'm 54 years old. I've been living with diabetes for 13 years, and I've been using Diabetes Manager for 7 or 8 months now. This application is terrific. Diabetes Manager gave me a sense of control.
The beauty of an mHealth application or a mobile health application is the ability to really be able to take care of your health care while you're with your doctor as well as when you're not with your doctor.
I test my blood sugar and enter it into Diabetes Manager about 4 times a day and give the results that have been stored on the phone to the doctor.
The beauty of the mHealth applications that are out there is that ability to make that information meaningful for both the patient as well as for the provider. Also being able to share that information when they go into their provider's office. That's really, again, I think one of the values of these mHealth applications. It's that ability to really be a companion to a patient who may not have that support system.
It records carbs, and I've learned to cook smarter. It's portable, easy, helpful. So having the Diabetes Manager is like having a person there saying, and this is what you need to do.
So the key takeaways with us were the employees are willing to adopt and engage in mHealth. They demonstrated a sustained use over a period of time. They reported positive behavioral changes. And so we'll continue to evaluate the data and the potential expansion of the program. Thanks for your time today.
Well, that concludes the presentation portion. Before I open it up to the audience, what I'd like to do is put the 3 of you on the spot for a second. You guys, I think, did a great job illustrating some really great success stories within your own organizations. Now, I can imagine to get to that point, you had to go through many, many challenges, opposition, you name it. So if you could, maybe just go down the line and speak to maybe one challenge and how your organization was able to overcome that challenge. Pat, can I put you on the spot?
Why not? You're good at it. I think we've had multiple challenges. First of all, it's the adoption of doing something so personal on social networking, on mobile devices. I think part of it is that we are under certain laws, primarily HIPAA, that don't allow for certain information to be transferred over the air, essentially, so that we can share that between provider and patient and whoever it is. So I think there's definitely challenges in that aspect that have caused us to really kind of rethink and recalibrate how do we actually do this effectively.
I don't know if that works. So I think for me, HIPAA, sure, great one. But I think another one for us that's been specifically very difficult to manage has been provider engagement. It's been very difficult to get providers super engaged with this, trust the system, put lots of patients on it, and then change their workflow pretty much to be able to adapt to this new age of more data, more liability, more real-time access, and all of that, without really aligning reimbursements, without really aligning workflow structures, without really aligning practice configurations to that. So I think for us it has been a sort of a waiting game for a while. You wait for these things to happen, but then you can't wait enough. I mean, it's like 10 years away. So you want to grab it, and then you want to change things, and you try to change them one thing at a time, and that's not enough. So I think we've gotten good at it. We now are able to present clinicians with evidence that it works. We think about it from their perspective, so we give them value propositions that make sense to them. So we talk about reduced no-shows, better engagement with patients, those kinds of things that we can affect right now without changing anything else, and a lot of physicians will actually respond to that. With the changing structures, like patient-centered medical homes, ACOs, there are some other value propositions that you can give them that will help them adopt. But the funniest thing for me is, and being a physician, I'm saying this, but the funniest thing is the way we make assumptions about our patients. I have heard this a million times, but it's always said this. Oh, my patients are never going to like that. Oh, my patients are never going to use that. At some point you want to stop and you want to really let the patient speak. So it has been interesting where we've actually forced it down, and the patients use it, and then these people are amazed about it. So my patients don't have smartphones. My patients don't have texting. Like, how do you know?
Kamal,
well, it's changing. So
that's a good point, though, Kamal. What would you say is the percentage that you see of providers or doctors that are starting to accept the things that we're talking about today? Ballpark figure.
I think it's sort of in line with the adoption curve. You'll always have the 10 to 15% early adopters, and then it's the late adopters and the laggards.
And it continues to accelerate as well.
Yeah, right? I think we used to see more of just the 10%. Now we see that growing, but I don't think it's significant enough at this point to say, okay, I can create this program and scale it across the system, right? Mm-hmm. I don't think that's there yet. But I think come 2014, when things change, we might see better rates of adoption.
Yep.
Well, I'd say companies within our industry, especially the legacy companies like AT&T, are known for having, at least in the past, very, very rich healthcare plans. So what's been difficult for us, and we're a 2/3 bargain for company with more retirees than active employees, retirees who we continue to provide benefits for. What's been difficult for us has been changing that cost share equation. And so introducing things like deductibles and out-of-pocket maximums, which have to occur within the healthcare space because people have to have some skin in the game. For us, that's what's been difficult. The introduction of technologies has been really easy. People embrace the introduction of technologies. They're looking for online health records, new tools like Diabetes Manager. So that's the easy part for us.
Sure. So kind of a follow-up to what you guys presented on today, and no doubt everybody in the audience has talked about this in length over the last day or so. We've talked about SMS, we've talked about social media, we've talked about web, mobile. Pie in the sky, what do you guys think is next in terms of engaging either your consumers or patients from a platform standpoint or medium?
Well, I'll take a shot at it. I think that disease states like diabetes, where there's clearly some need for dialogue, I think you'll see those types of solutions proliferate across other disease states.
Sure.
I think the technology will allow doctors to actually now talk to each other specific to a patient. That's an amazing thing, right?
Yep.
That needs to happen, and I think technology will allow that to
More
happen.
doctor-to-doctor collaboration when it comes to a patient.
Yes.
Yep.
Yeah, so I think to add to that, interoperability is going to be really that key, that next step. Today we have mobile, we have web, we have all of that stuff out in the marketplace today, but we know that it doesn't work together. And I think with the healthcare exchanges that are coming, with a number of other things, we talk about cloud technologies, we talk about big data, all of that's going to come together with interoperability, and I think it's going to allow us to speak. So regardless of if you're with a certain carrier or if you're with a, whoa, that was weird, if you're with a certain healthcare company, okay, that's just too much now. All right. Regardless of who you're with, your data is always going to follow you, and that's what I think that next evolution is with healthcare today, is that it's going to keep going with you regardless of where you are, where you're at, how healthy you are or not, so that regardless of who you see, that latest information is going to be available at that point of care to make the right decision making.
Wow. So I think instead of sort of committing myself to here's what it's going to look like, I'm going to sort of lay out components that I think are going to be essential to success, right? The first thing I think is easy, passive data collection. Anything that makes patient enter 4 numbers in 4 different windows anywhere on a web or a mobile phone is just going to, eventually not going to see engagement. I think the more passive, the more easy, the more sort of seamless you make the experience for the patient, the better your engagement and the longer your engagement is going to be. So that is key. The second thing that's key is personalization. I mean, I think the days of sort of generic messaging are over. I don't think anyone engages or anyone likes the generic how you feeling today kind of messages anymore. So be it delivered by smartphone, text, or whatever else, it has to be hyper personalized and relevant to people. And then I think the third thing that I'm going to say is it can't be one channel. It probably has to have the capacity to be able to absorb multiple channels and still make it easy and seamless for people. So I think anything that probably has these 3 components probably will be the future.
Well, thank you for answering my questions. At this point, I'd like to ask the crowd, any questions for these gentlemen?
So the talk this morning by Mark Bertolini, I think he indicated that about 20% of his members account for 80% of their costs, and I wouldn't expect at AT&T or at UHG that dynamic to be any different. I really don't want to be a patient, and so a lot of these programs seem oriented toward disease management. And I know we had limited time, so you focused on diabetes, but I was just wondering, do you have programs for the well or programs to model what it takes to be a healthy person throughout your life?
Yeah, great question, and you're right, we do a lot around disease management, but we do also have a lot of, I would say, preventative programs as well that really look for those that want to be healthy and remain healthy to keep that in place there. So as an example today, we have a number of incentive programs, one in particular that we use as employees ourselves, that you have to go out and get biometric screening on an annual basis. But there's an incentive to do that in that if I do this personally, I get that financial incentive at the end of the year if I'm just taking that action. So there are things on that preventative measure that we do for that. We also have a number of mobile applications and portals where you can actively put in information. The one I showed up there was called OptimizeMe, is an application primarily for those that want to stay fit or get to a point of being fit, that you can monitor that on a regular basis. That information actually goes back to our nursing staff as well. So if there are any triggers, they're the first ones to give you a call and say, hey, we've noticed something in your regiment or something like that. So we do have a number of programs on the preventative side.
Marty?
Yeah, the same here. I would say there are probably, a lot of the programs we use are actually United Healthcare programs. So, but we have an internal website that we've developed. It's the Your Health Matters portal. We have about 1 million hits on it, and has lots of things like, exercise programs, challenges that we have going on. We have, I think what you're seeing actually is a cultural change within the company that all the tools that we provided are allowing for. And then just quite frankly, the plans themselves are designed in such a way to incent preventive care. Preventive care is free. So lots of things we could talk about, but there's a big focus on health as well as disease management.
Sir?
I have a question about the barriers of employee wellness programs. My question is, how do you manage the fear by employees about their privacy, especially the potential of employer know something about them and they are worried about losing their jobs?
That's a great question, and I don't know that I have any panacea to the issue. I can tell you that we communicate all the time how private the information is. We are very self-policing on any issues around HIPAA and privacy. We constantly inform our employees that that is not something within the company, that we have purview to that data and information. And so it does come up from time to time, but I can tell you that internally we take great pains to avoid that types of information. In fact, when we receive it, and we do at times from employees, there's kind of a little bit of a fear factor because we don't want that information. And so we just continue to communicate the privacy issues, and that seems to work for us.
Yeah, to add on to Mr. Webb here, at United Health Group, we definitely take security the utmost importance. In fact, I used to be from the security group, so I've seen it firsthand as well. But in that case, what we do is, for employers such as AT&T as an example, when we share data with them, we share summary level data. It's not individual layer data at all. So they could see from a condition management standpoint that there might be 300 people in the diabetes program or whatever program that we have in partnership with them, but they don't see the individual names. The only one that actually sees the individual names are the nurses and clinicians that we have on staff that are authorized to see that data so they can take some kind of healthcare action. So we do take the utmost importance when it comes to security.
I guess just to follow up, Pat and Marty, would you say that social media, for example, has really helped, I guess, springboard or allow these types of programs, just because people are more and more comfortable sharing information and understanding and learning where it's going to end up? Because when you think about it, at one point people didn't want to purchase things online because they were afraid of where their information was being stored or where it was going. So do you think social media has kind of led us into that direction as well?
I think it's probably had a positive impact, and it's probably had a negative impact, because it's so easy it's so easy for information to be shared, whether you want it to or you don't want it to. But I will say this: when you bring health and wellness to the forefront, and when we show a lot of videos of real employees and what's happened in their lives, I think what happens is people want to help. And we find more and more, especially on our social media site, that people want to talk about what they've been through. And we allow that. We allow them to talk about as long as it's them doing that, to talk about what they've been through. And then there's a sharing of information. And so I won't say social media necessarily doesn't cause any problems. It probably does, but I think net it's had a positive impact.
Sure.
Yeah, and I would definitely agree with that. I think if you're out on Facebook and you can share your most private information with people you haven't seen in 20 years, they're more apt to also share that data with us as well. So I think there's more ease in sharing that data and giving it up. But at the same time, as Marty mentioned, that there's that negativity within that. We just don't have, I think, the advancement today to really secure some of those channels where you are sharing your private information. And so it is a balancing act that we're at where we're at today.
Yeah. Thank you. Sir?
In Mark Bertolini's keynote this morning, he sort of talked about how the role of the payer is changing in healthcare. His kind of idea was it's a get out of the way between the patients and the doctors kind of a thing. But I was wondering what you guys as payers, what your take on that is, and whether you think kind of what the interplay between that change and social media and mHealth is. I mean, is one driving the other, or what's that relationship?
Yeah, good question. I think when it comes to that, as a payer organization, we need to change how we are practicing and going forward. Not only are we a payer when it comes to claims, but we got to be more than that. We need to provide the upfront care management from a preventative standpoint, using the data that we have to get people out there, to get them engaged with their providers and the tools in their hands that they need to make the right decision. So I think us as payers cannot go forward as traditional payers as you are aware of today. Rather, we need to change the game for ourselves and how we interact with our consumers and our members and giving them the right information when they need it.
This is a question for Dr. Jeffwani. My name is Tony Pisani from the University of Rochester. You mentioned that you said this is a data gold mine, what the adolescents were sharing on that site. I wonder if you could reflect more about what about that data would interest you, and what do you think could be gleaned from the kind of things that they're sharing there?
So, I mean, it's Olomo, just the whole thing, the whole realm is data rich, right? I mean, there are companies today that use mobile data, just things like how many calls you've made in a day, how many texts you've sent, as ways to start detecting how you're doing on your depression medications, for example, or how quickly you're reacting to that, responding to that. There are algorithms today written to mine data from Facebook that will tell you a lot about how people are motivated, for example. So, the data we're collecting about people on the Facebook group, for example, in the teenager program, we also mine a little bit of their background data, and potentially in the future, will be able to tell us a lot more about how they interact, what modalities they prefer. So if everyone's a chatter, maybe engaging them in that way makes more sense than trying to give them something else. But also, I think, in general, we've seen a lot of interesting motivational techniques that you can explore on Facebook. If you always get influenced by friends or what they're posting, or what your family's posting, that's what we want to get you in touch with. And we know that if they are involved in your healthcare, that you might be able to do things that you need to do, right? So those are the kind of things that social networks and the data that's available there will tell you. Mobile, local, I mean, I don't need to tell you, it's like, if I know you're entering Dunkin' Donuts and I can message you at that time, that's awesome, right? And I can make you drink the coffee without the cream instead of the donut or whatever. So each of those three aspects have very interesting ways in which you can use data. Does that answer your question? Okay.
Any other questions from the crowd? No? Well, thank you very much to our panelists. Thank you for the crowd.